Melasma Home Remedies. Remedies Medical Treatment Takeaway. Overview. Melasma is a common skin disorder characterized by gray-brown discolored patches of skin on areas of the face exposed to the sun. Melasma can affect anyone, but it appears most often in women who have darker complexions. It's been associated with female hormones. Melasma is also a common skin disorder for the following groups: women using birth control pill, pregnant women, menopausal women using hormone replacement therapy. Melasma's symmetrical dark patches are brown to gray-brown. They can occur on the forehead, cheeks, chin-nose-upper lip. Melasma Home Remedies. If your melasma is triggered by pregnancy or birth control pills, it's possible the discolored patches will fade on their own after the pregnancy or if you stop taking the pills. You might consider treating your melasma at home, though. Here are some common home remedies. Aloe Vera. A 2017 study trusted source on pregnant women with melasma found using a topical, liposome-encapsulated aloe vera preparation significantly improved their melasma. Polypodium leucodermas. This is a fern native to Central and South America. It's sold under the brand names Kalawala and Heliocare. It's also called Caliguala and Anapsos. A 2014 review trusted source of literature found orally taking Polypodium leucodermas can treat melasma. However, researchers don't include a recommended dosage. Tranexamic acid. According to a 2017 literature review trusted source, tranexamic acid is another promising oral therapy for melasma. This acid is a synthetic derivative of the amino acid lysine. Glutathione. This antioxidant comprises 3 amino acids: cysteine, glutamic acid, and glycine. It's found in most mammals. The same 2017 review trusted source found that, when taken in an oral form, glutathione decreased melanin in people with melasma compared to those who took a placebo. An excess of melanin production can lead to hyperpigmentation. Sun protection. Protect your skin. Wear sunscreen every day, and reapply every 2 hours. Consider wearing a wide-brimmed hat when you're outside. Melasma medical treatment. Your doctor may refer you to a dermatologist. They can confirm a diagnosis and suggest medical treatments to even your skin tone. One option may be hydroquinone. This topical treats hyperpigmentation. It's available in over-the-counter or prescription strength as a lotion, gel, cream, or liquid. Other treatments may include tretinoin corticosteroids triple cream, combination of hydroquinone, tretinoin, and a corticosteroid, azelaic acetic acid. If topicals aren't working, your dermatologist might recommend a procedure to treat your melasma, such as chemical peel dermabrasion, microdermabrasion, laser treatment, light-based procedure, microneedling. Takeaway. You may have melasma if you have gray-brown patches of skin on your face. Your doctor can confirm a diagnosis and provide treatment. Be patient during treatment. It often takes months before results are seen. And once your melasma clears, your doctor might recommend maintenance therapy to prevent it from returning. No matter what treatment is the best option for you, remember prevention is key. Wear sunscreen every day and a wide-brimmed hat whenever you're outside. 6 sources collapsed. Melasma. Symptoms, risk factors and causes, diagnosis, treatment, coping. We include products we think are useful for our readers. If you buy through links on this page, we may earn a small commission. Here's our process. What is melasma? Melasma is a common skin problem. The condition causes dark, discolored patches on your skin. It's also called chloasma, or the mask of pregnancy, when it occurs in pregnant women. The condition is much more common in women than men, though men can get it too. According to the American Academy of Dermatology, 90% of people who develop melasma are women. Symptoms of melasma. Melasma causes patches of discoloration. The patches are darker than your usual skin color. It typically occurs on the face and is symmetrical, with matching marks on both sides of the face. Other areas of your body that are often exposed to the sun can also develop melasma. Brownish-colored patches usually appear on the cheeks, forehead, bridge of the nose, chin. It can also occur on the neck and forearms. The skin discoloration doesn't do any physical harm, but you may feel self-conscious about the way it looks. If you notice these symptoms of melasma, see your healthcare professional. They might refer you to a dermatologist, a doctor who specializes in treating skin disorders. Causes and risk factors of melasma. It isn't totally clear what causes melasma. Darker-skinned individuals are more at risk than those with fair skin. Estrogen and progesterone sensitivity are also associated with the condition. This means birth control pills, pregnancy, and hormone therapy can all trigger melasma. Stress and thyroid disease are also thought to be causes of melasma. Additionally, sun exposure can cause melasma because ultraviolet rays affect the cells that control pigment, melanocytes. How is melasma diagnosed? A visual exam of the affected area is often enough to diagnose melasma. To rule out specific causes, your healthcare professional might also perform some tests. One testing technique is a Woods lamp examination. This is a special kind of light that's held up to your skin. It allows your healthcare professional to check for bacterial and fungal infections and determine how many layers of skin the melasma affects. To check for any serious skin conditions, they might also perform a biopsy. This involves removing a small piece of the affected skin for testing. Is melasma treatable? For some women, melasma disappears on its own. This typically occurs when it's caused by pregnancy or birth control pills. There are creams your healthcare professional can prescribe that can lighten the skin. They might also prescribe topical steroids to help lighten the affected areas. If these don't work, chemical peels, dermabrasion, and microdermabrasion are possible options. These treatments strip away the top layers of skin and may help lighten dark patches. These procedures don't guarantee that melasma won't come back, and some cases of melasma can't be completely lightened. You might have to return for follow-up visits and stick to certain skin treatment practices to reduce the risk of the melasma returning. These include minimizing your sun exposure and wearing sunscreen daily. Coping and living with melasma. While not all cases of melasma will clear up with treatment, there are things you can do to make sure the condition doesn't get worse and to minimize the appearance of the discoloration. These include using makeup to cover areas of discoloration, taking prescribed medication, wearing sunscreen every day with SPF 30, wearing a wide-brimmed hat that shields or provides shade for your face. Wearing protective clothing is especially important if you'll be in the sun for an extended period. If you're self-conscious about your melasma, talk with your healthcare provider about local support groups or counselors. Meeting other people with the condition or talking with someone can make you feel better.